For hundreds of years, the royal family has built a perfect image of grace and duty. But behind the palace walls lies a secret history of mental distress, hushed-up crises, and cries for help that were completely silenced. Their family motto is literally, "Never complain, never explain," which turned the palace into a prison where any sign of vulnerability could destroy their image. In this video, we're exposing the shocking mental health secret the royals tried to bury, from a king labeled mad to a duchess allegedly told her suffering was bad for the brand. Section 1, A Legacy of Concealment. It began centuries ago with King George III. Most know him as the monarch who lost America, but historians now believe his symptoms pointed to bipolar disorder. Back then, they called him mad and treated him with straitjackets, restraints, and invasive procedures. Treated with physically abusive and ineffective 18th century medical practices. Back in the 1700s, royalty wasn't just admired, it was revered as almost divine. The idea that a monarch could suffer from a mental illness wasn't just scandalous, it was unthinkable. A mad king wasn't just a personal tragedy, it was a political threat. That fear of perceived weakness planted the seeds of centuries of silence. Then there's the tragic story of Queen Elizabeth II's cousins, Catherine and Nerissa Bowes-Lyon. Born with severe disabilities, they were institutionalized in 1941 and listed as deceased in official royal documents for decades. When the truth emerged in 1987, the palace gave no comment, just silence. 2. The princesses who suffered in silence, endurance without expression is the norm. In the 20th century, the royal silence continued. Princess Margaret struggled with depression, but family attitudes reportedly dismissed mental illness as weakness. Her suffering went largely ignored. Then came Princess Diana. Behind the fairy tale image, she battled bulimia, postpartum depression, and even self-harm. She once said she was crying out for help, but giving the wrong signals. When she asked for support during pregnancy, Prince Charles allegedly called it crying wolf. In 1995, she went public, revealing her bulimia to the world and breaking the family's code of silence. When Diana revealed her struggles in that infamous BBC Panorama interview, it sent shockwaves across the world. For the first time, the public saw that even the most glamorous royal was deeply human, flawed, vulnerable, and hurting. It forced a conversation about mental health that many families had been avoiding, not just royals. 3. A prince's trauma and a new dawn. Diana's death left a heavy burden on Prince Harry. At just 12 years old, he buried his emotions, which later led to anxiety, panic attacks, drinking, and drug use. He once described it as holding a beach ball underwater until it bursts. Meeting Meghan Markle helped him finally seek therapy. He and Prince William launched the Heads Together campaign to address mental health publicly. It looked like real change was coming. It can be argued that Harry's silence wasn't just about his mother's death. It was also about duty, about stiff upper lip, about growing up in a system that rewards silence over honesty. His emotional collapse wasn't sudden. It was the result of years of being told to man up and carry on. 4. A modern crisis and a shocking echo. But that hope faded when Meghan Markle shared her experience. While pregnant, she had suicidal thoughts and pleaded for professional help. According to her, she was denied support because it wouldn't be good for the institution. Harry called it total silence and neglect. This eerily echoed the royal response from generations past. While some were quick to dismiss Meghan Markle for speaking out about her mental health, others saw her honesty as a lifeline. Many believe her bravery in coming forward will end up saving lives by encouraging others to seek help, speak up, and break free from silence. 5. Public platform versus private pain. Which makes the contrast even more striking, because while Meghan says she was denied support, William and Kate are now seen as global ambassadors for mental health. They've co-funded a pilot program to expand mental health services in rural communities. Kate has said, "Fear of prejudice and judgment stops people from getting help." But Meghan's testimony suggests that very prejudice may have existed inside the palace itself. Meghan's experience paints a different picture, one of internal stigma and image control. The institution that tells the public to speak up allegedly silenced its own. Final thoughts and your turn. From a tortured king to a suicidal duchess, the royal family's history with mental health is both heartbreaking and revealing. The royal family has always been a symbol of endurance. But maybe the true strength lies not in enduring pain silently, but in confronting it openly. If mental health struggles can exist inside a palace, then maybe it's time we stop pretending that power or privilege makes anyone immune to being human. They show an institution that, when it's faced with an uncomfortable truth, might just go back to its oldest trick in the book: silence. Have things really changed, or is this just a PR makeover? Let us know your thoughts in the comments. Thanks for watching. Like, subscribe, share.